primary dose to those at low risk. Together, we will save the most lives by making sure health workers, older people, and other at-risk groups receive their primary dose of vaccines. In most countries, those being hospitalized and dying are those who have not been vaccinated. So the priority must be to vaccinate the unvaccinated, even in countries who have better access to vaccines. It's really quite simple. The priority in every country and globally must be to protect the least protected, not the most protected. There remains a vast gap in rates of vaccination between countries. 41 countries have still not been able to vaccinate 10% of their populations, and 98 countries have not reached 40%. We also see significant inequities between population groups in the same country. If we end inequity, we end the pandemic. If we allow inequity to continue, we allow the pandemic to continue. Tariq, back to you.
Thank you very much, Dr. Tedros, for these opening remarks. We will now open the floor to questions. We have a number of journalists already raising their hands, so I would really ask everyone to be short and ask one question only. So we will start with Nina Larsen from Agence France Presse. Nina.
Yes, hi, thank you. Thank you for taking my question. I wanted to ask about the study that came out of South Africa today that showed that the Pfizer-BioNTech vaccine was 70% effective in stopping severe illness from Omicron. I think that is lower than against previous variants, but perhaps higher than you had expected. Have you seen the data on this, and how do you think this data could impact your views going forward on the recommendations of a third dose? Thank you.
Thank you, Nina. So we will start with Dr. Kate O'Brien.
Thanks for the question. And as you know, the data on Omicron and the performance of vaccines is in very early days. Both laboratory studies of the sera from people who have been vaccinated, as well as now real-world evidence on the performance of the vaccines against clinical disease. So we're looking at the report, evaluating exactly what was studied and the results from the report. And I think what's really important to recognize here is that, and we've had a report also, as you know, from the UK on Friday. What's really important is that these are early reports, and there are considerations about exactly who was vaccinated, what the disease severity is. So certainly of significant interest, and we'll continue working with partners on additional reports that we know are coming, because it really is about an aggregate of evidence from around the world. I think the important thing, though, is that really we have to emphasize that transmission of Omicron is not going to be solved by vaccine. Protecting people against that severe end of the disease spectrum is really critical, but we have to be doing all of the interventions in order to assure that we have the lowest transmission possible as Omicron is moving its way through different populations. Thank you.